let's talk about low-grade prostate cancer and watchful waiting or observation. So sometimes we do a biopsy of a gentleman and we find that he has low-grade prostate cancer, specifically Gleason score 6, which is the lowest grade. And sometimes we talk about watchful waiting, and sometimes that it's appropriate. And there are many men who have responded that they're in this situation. So let's discuss. Why do we sometimes discuss watchful waiting for low-grade prostate cancer? Because we know in some men who die of natural causes in their 90s and 100s, they have little deposits of Gleason score 6 prostate cancer. And to them, it's not dangerous. And why expose men to the side effects of therapy? Because there are side effects. Less than there have been in the past, but there are side effects. So why expose men to side effects of therapy if they're unlikely to run into a problem? So that is the rationale. Now, there's the biology of the cancer, and then there's the reality and the angst and the worry that happens. So sometimes patients are told they have Gleason score 6 prostate cancer, and they go on watchful waiting. But what's watchful waiting? Watchful waiting involves a certain amount of anxiety for people because they get their PSA checked every 6 months or every year. Sometimes they need a repeat MRI, and sometimes they have to have repeat biopsies. And they worry because they've been told they have cancer. And sometimes it causes angst, worry in them or in a family member. And then sometimes they come in with a binder of every article written on prostate cancer. And sometimes it's the right thing just to treat it, to put it behind them. So sometimes there's a biology of the cancer. In this case, Gleason score 6 is low risk. And sometimes there's the angst and the worry about having cancer. And in some patients, I look at them, I say, just let's treat it, put it behind you. You don't have to worry about it again. So it just depends on the individual.